92.
The Obama administration is announcing a new push for health care reform, this after months of insisting that he would leave the details to Congress. We're learning now the president plans to take much greater control over the debate. What do lawmakers think about all of this? Joining me now to talk about it is New York Congresswoman Carolyn Maloney, a Democrat on the House Financial Services Committee, and Arizona Congressman Trent Franks, a Republican on the House Judiciary Committee. Thank you both for being with us. Representative Maloney, one Democrat who is apparently familiar with the deliberations of the White House is quoted in the New York Times as saying that the president is worried that he's losing the debate over some of the policy prescriptions he wants, namely a government-run insurance program that would compete with private insurers. Do you think that's why the president has now decided he's going to get involved?
Well, I think he's decided to get involved because he cares deeply about health care and making sure that the 46 million Americans that don't have health care will have access to health care. He played a tremendous role in the passage of the Credit Card Holders Bill of Rights, a bill that I authored that was very, very difficult to pass, but he spoke about it, he talked to lawmakers, and he helped build momentum to get it to his desk before Memorial Day. I think he has said to Congress that he would like a bill passed out of Congress by the end of July. And that's a very short time frame. So he cares deeply. He wants to make sure it happens for the American people.
Congressman Franks, as you know, under Article 1 of the Constitution, it's Congress that makes the laws, and it's the president that executes those laws. So by becoming intimately involved now in the making of this health care law, arguably is the president sort of usurping the authority of you in Congress and violating, in a way, the separation of powers.
Well, you know, the three basic rights in our Constitution, Greg, are life, liberty, and property. And it seems that the administration is dedicated to wiping all of them out in the first 6 months of its administration. But I want to correct one major fallacy that the administration tries to put forward, and that is that somehow Republicans, conservatives like myself, don't want the poor to have health care. And nothing could be further from the truth. We desperately want them to have the best health care that medicine can offer.
You just don't want a government plan that would compete with private insurance.
Would hurt that desperately. It will hurt them more than anyone. Yeah. And I think we could outlaw health care in Congress and do it less damage than somehow government taking it all over.
Government, Maloney, why does the government have to get into the business of providing a health care plan that would invariably compete with private insurers?
Well, actually, today on your earlier on Fox News, the CEO of Google said that health care was intimately involved with the cost of it, with his ability to be competitive in the world market. 18% of our GDP is health care. We need to reform it. We need to make it more cost effective, and it is inefficient. We need to make it more efficient and available.
Why does the government have to provide a plan? Why can't the government enable universal health care coverage with private insurers?
Well, we have been talking about it since 15 years ago when the Clintons came forward with their plan, and the number of uninsured has been growing, not
that was a long time ago. The political landscape is dramatically different.
It has not. They have not expanded health care. Under President Obama, we expanded health care for needy children, those who could not afford it. They expanded the S-CHIP program that provided health care to children who could not afford it. It was vetoed twice by former President Bush. It was one of the first achievements of the Obama administration, and he wants to move forward by
Congressman Franks, let me go to you. I don't want to leave you out of this discussion. I was looking at an analysis today of data from the Census Bureau. It shows that a full 1/3 of the 47 million uninsured in America are here illegally. Should the government get into the business of helping people who are here breaking the law by enabling them to get insurance, and if not subsidizing it?
Well, I think that to spend taxpayers' money on subsidizing the illegal acts of others is probably not the direction we want to go in. But the big issue here is the whole healthcare system itself. And the Republicans have an alternative plan that would empower individuals to be able to go out in the private sector and find access and gain access to private health care, and it would keep the competition going. The way you keep the pressure on for the best health care at the least cost is in a market-driven system. A government-run health care only puts pressure on trying to deliver less health care.
Yeah.
And I'm just astonished here, Greg. We are seeing a major rewriting of America here. If we continue down this road of socializing health care, socializing defense policy, politicizing the courts, politicizing the economy, we're going to have to start calling America by some other name.
Yeah, Representative Maloney, you're never going to get universal coverage unless you cover the uninsured illegals. Again, 1/3 of the 47 million in America. You got to do that to achieve your goal, don't you?
Well, Greg, we pay more for health care than any industrialized nation. We pay more per capita than any other. Yet when you look at what we're getting for our health care, we are 49th in the world in terms of infant mortality and 50th in terms of longevity. So we're not doing that well. We need to do a better job. We need to be more cost effective and to allow a public option so that...
Are you in favor of providing illegals coverage?
So that individuals can decide which health care they want to have. So that you would decide where you're going to get your health care. You can. One of the things that's good about this program, it lets everybody keep the health care that they have.
Illegals too?
Yes, if they have. Yes, it does allow them to keep their health care.
You're in favor of providing a government plan for illegals?
This is a government plan for the American people.
Does that include illegals?
In New York City, as you know, we have public hospitals that take care of people even if they are illegal, and in other cities and states across the country.
Representative Carolyn Maloney, Representative Trent Franks, thank you both. Julie?
All right. Well, Conan